You want to support Roland Martin Unfiltered? Be sure to join our Bring the Funk fan club. Every dollar that you give to us supports our daily digital show. There's only one daily digital show out here that keeps it black and keep it real as Roland Martin Unfiltered. Support the Roland Martin Unfiltered daily digital show by going to RolandMartinUnfiltered.com. Our goal is to get 20,000 of our fans contributing $50 each for the whole year. You can make this possible. RolandMartinUnfiltered.com. The White House Coronavirus Task Force is holding their daily update. Donald Trump, he is speaking at the podium. We will not take him live because he lies too much. Once Dr. Fauci or Dr. Birx steps to the microphone, then we'll go to the news conference. We will not be showing you somebody who consistently lies. Now let's talk about the latest details when it comes to COVID-19. 422,369 cases of COVID-19 in the United States as of today. In its 3 territories, 14,463 people have died due to coronavirus. That's 1,905 more than yesterday. 22,187 people have recovered from the virus. Tragically, a large number of those impacted are African American. The Congressional Black Caucus is calling racial data reporting in these cases critical. Joining me right now is Congressman Al Green of Texas. Congressman Green, glad to have you back on Roland Martin Unfiltered.
My honor to be back with you, and I look forward to the interview.
Very simple. When you look at what's happening across this country, when you finally saw yesterday during the briefing where this issue came up. Folks, if y'all have the video of Dr. Fauci talking about this yesterday, please roll it right now.
A brief comment to get back to the discussion about the health disparities in the African-American community, because it really is very important. And the reason I want to bring it up, because I couldn't help sitting there reflecting about sometimes when you're in the middle of a crisis like we are now with the coronavirus, it really does have ultimately shine a very bright light on some of the real weaknesses and foibles in our society. And as some of you know, the greater proportion of my professional career has been defined by HIV/AIDS. And if you go back then, during that period of time when there was extraordinary stigma, particularly against the gay community, and it was only when the world realized how the gay community responded to this outbreak with incredible courage and dignity and strength and activism, that I think that really changed some of the stigma against the gay community, very much so. I see a similarity here because health disparities have always existed for the African-American community. But here again, with the crisis, how it's shining a bright light on how unacceptable that is. Because yet again, when you have a situation like the coronavirus, they are suffering disproportionately. As Dr. Birx said correctly, it's not that they're getting infected more often, it's that when they do get infected, their underlying medical conditions, the diabetes, the hypertension, the obesity, the asthma, those are the kind of things that wind them up in the ICU and ultimately give them a higher death rate. So when all this is over, and as we've said, it will end, we will get over coronavirus, but there will still be health disparities, which we really do need to address in the African-American community. Thanks.
Congressman Green, I hope it's amazing how mainstream media, after Dr. Fauci made his comments yesterday, decided to focus on the racial disparity in these deaths. Look, we've been focusing on this since day one, knowing full well this was going to impact black people in a great way.
Yes, sir. It does impact black people in a great way because we've known for some time that whenever we have circumstances such as this, black people are always impacted in a great way. Why would this be an exception? The interview was garbled, so I didn't get a chance to hear it in its entirety. But I would say this, the statistical information is overwhelming. The empirical evidence is indicating that in Michigan, 14% of the population is African American, with 41% of the deaths being African American. That is totally unacceptable. And then you look at Milwaukee, 26% population African American, 73% of the deaths. And the numbers are all disproportionate. I would add right here in Houston, Texas, we had 11 deaths, and 7 of them are African Americans. We have to make our issues surface, not only such that people will talk about the statistical information, but we have to do something about it. And one of the things that we have to do is demand health care for all. We have to have it because we have these pre-existing conditions, diabetes, heart disease, lung disease, and that health care has to cover the pre-existing conditions. If we cover the pre-existing conditions, we'll have a better opportunity to survive. We understand now that there really is a connectivity within humanity. We've always said that if I cannot be all that I can be until you all you can be. Well, we now understand that there's a reality associated with this, and regardless of how you got in this country, you ought to get health care because my health depends on the health of other people within the country. We have to demand it. And I would add one more thing. People who say that African Americans should be especially careful, I heard an elected official say this, well, we should be. But it's difficult to be careful when you are the person who works in the sanitation department. It's difficult to be careful when you're the person who drives the truck, the delivery truck, when you're the person in the grocery store bagging the food. We have hands-on jobs, and these hands-on jobs do not allow us the luxury of being careful to the extent that other people are careful. And we don't get the level of appreciation for what we do for this country, given the circumstances and conditions that we have to suffer.
Well, and one of the things that we are also seeing is that, frankly, this coronavirus, and I've been saying this, is exposing the underbelly of the reality what's happening in America. We're seeing it when it comes to healthcare. We're seeing it when it comes to education. We're seeing it when it comes to the pay of nurses. We're seeing it when it comes to how vital teachers are. We're seeing it in so many different ways. And so I would hope political and economic leaders are using this moment to say, hey, we've talked about inequality for a long time. Now you're seeing it front and center. And a lot of people, Congressman, who have ignored this inequality, they're now having to confront it because they, too, are sitting at home without money coming in.
Absolutely. We understand that the wealth of a nation is dependent upon the health of a nation. We, for too long, have allowed ourselves, many African Americans, by the way, to believe that we are a problem. We're not a problem. Racism is the problem. And what we've had to occur in this country is allow it to become a race problem, which means you can blame the people. The victims become the problem. But if we say racism, now we're getting to the root cause of the problem. We deal with the symptoms of the problem. It's time for us to ignore the fact that other people want to deal with symptoms. Let them do so. But we have to deal with the problem, which is racism. It is a systemic racism. And if we avoid saying that, we do ourselves a disservice. This has exposed the fissures within society, but if we don't talk about them and do something about them, we will just have another episode, another incident, another circumstance where they were exposed, but we didn't take proper action. We've got to talk about the racism, and the racism produces all of these disparities that we're talking about. You can trace them right back to a racist society that has allowed these things to foster and fester, and we have to have solutions that include dealing with the racism, not the symptoms. The racism itself has to be dealt with.
One of the things that also I want to talk to you about that we're seeing, you have Mitch McConnell and Treasury Secretary Steve Mnuchin, they're both now saying more money is going to have to be put in when it comes to helping these small businesses. $350 billion. Look, they already realize it's going to run out. I mean, the demand through banks and other places has been tremendous, and they're talking about another $250 billion. I'm telling you right now, you even have folks like Senator Josh Hawley, who is saying that the federal government maybe should be sending payments directly to small business owners because the SBA is also saying that they simply are overwhelmed and aren't set up for the number of claims that are coming in. And so just your thoughts on what's going to happen there, because I'm hearing from black small business owners who are saying that, look, they're being shut out. The banks that do SBA lending are saying that if you don't have a previous relationship with them, they're not going to work with you. And so what do small black-owned businesses do?
Well, I'm glad you brought it up. Very important subject. The black-owned businesses, many of them are mom-and-pop businesses. Black-owned businesses don't have 500 employees. A good many businesses do, but most of the black-owned businesses do not. So they are trying as best as they can to get into this delivery system, and they're having difficulties because a good many of them don't even have bank accounts that relate to the business. A lot of black-owned businesses, people who just write checks on their personal accounts to get things done. They're small, but they're functioning, and they're part of our economic order within our community. So I do agree that we have to have a better delivery system, because you have big banks that are not interested in dealing with them because they haven't been customers. Many of them have been trying to get into the system. They go to community banks, but our community banks are having problems because they don't have the technology to access the system as quickly as the big banks. The day that this system went into place, on that tri-day, by noon, $1 billion plus had already been accessed from this pool of money. $1 billion. Black-owned banks were not a part of that pool because of the technology and other things associated with their smallness. So we've got to do more to help these banks because they're in the LMI communities, the communities where people are low to moderate income. We've got to help them. They're part of our delivery system. But we still have to focus on those businesses. And just as we've sent direct payments to people, and we need to do more of that, they need to be recurring. The Honorable Maxine Waters has legislation pending for us to send more money and send it more often. One time is not enough. But the direct funding should also take place with our businesses. Those that can be properly identified, let's get the money to them as directly as possible. The delivery system we have is not functioning properly. I would hope that we can correct it, but if we can't, we've then got to circumvent that system and go directly to the business owners themselves.
All right, then, Congressman Al Green, we certainly appreciate it, sir. Thanks a lot.
I thank you very much. You are a strong voice. God bless you. Be strong. Carry on.
I appreciate it, sir. Thank you so very much.
I
want you to like, share, and subscribe to our YouTube channel, youtube.com/Roland S. Martin. And don't forget to turn on your notifications.